Thank you, Dr. Munzer. I'm happy to introduce a good friend of mine, Jason Madison, who also has MPS too. And one of the things, and Jason will probably talk about this a little bit, that Dr. Elton just said is the tremendous MPS community and the amount, he didn't say that part, but the amount that we talk to each other. So I think that's really important, that we are very connected in our community. So Jason?
Hello, everyone. I'm sure you had a long day, and hopefully this presentation will allow you to just kind of ease into the evening and help you process everything. I didn't want to blur my background because I really like my Muppet paintings, so there you go. But so I'll give you a little eye, but I will bring up my PowerPoint presentation. Oops, hold on one sec. Let me see. All right, let's see. All right, is it sharing okay? I'm guessing. Kim, is it up okay?
Yes, Jason, it's sharing.
All right. So my name is Jason Madison, and I have MPS2 Hunters. And before I continue, I'll go back. Oh, I did have my there you go, my COI. I am a compensated patient consultant for Denali Therapeutics and Lumanity out of the United Kingdom. So, my story. I'm 49 years old. When you get to your 40s and close to your 50s, I had to actually look it up because you're like, 40 something, but I'm pretty sure I'm 49. I did the math. So, I was originally born in Nyack, New York. Um, I was raised in a small town, Cortland, New York, about a half an hour south of Syracuse. Um, and I've been a bit of a rambler. I've lived in Brooklyn, Seattle. I spent some time in Chapel Hill, doing a clinical trial with Dr. Munzer, and been all over the place. And currently, I live in Allentown, Pennsylvania, about an hour and a half outside of Philly. So I have a bit of a different story than a lot of MPS families because in my family, we can trace it back at least four generations. So even though it's not fortunate that I have MPS, I am fortunate for my family's history of MPS. So we knew about it by the time that I was, born, and it wasn't a shock to the family system. It was a we had some experience caretaker wise and everything, and I think that was really helpful. But so as far as we can go back, and we don't know because these guys, were alive and born before even Hunter syndrome was even a thing. So you can only tell on the pictures, and I'm sure you can see in these old photographs, you can tell, just by, like the visual things of the hands and some of the facial features, um, that they had Hunter syndrome. So we had Glenn Silverthorne and Jay Silverthorne. And one thing I also wanted to bring up is, they ended up passing away pretty young. I mean, we have an attenuated version or an attenuated form of MPS, Hunter syndrome. But so for years, I thought, they just died young because of the healthcare. But a number of years back, I actually learned that they both killed themselves. And I think that is directly related to just the quality of life and healthcare. But it also brings home to the point of how mental health is also very important for the patients as well as the families. Um, so think as the care goes forward and people become more aware of Hunter syndrome, they're able to treat physical symptoms and also work on the quality of life issues going forward. Yep, and here you see him going over, and I love this picture of the farm. If you notice, they have this really awesome dog just hooked up to a wheelbarrow, and I always thought that was really fun. Um, so my great uncle, his name is John Van Camp. And he lived to 52 years old. He ended up actually dying of pneumonia, which is something that hit hard. So, uh, I just have recovered from a real bad COVID pneumonia. So, uh, it, that thought does hold hard because there are a few moments that I'm like, oh, I'm not sure if I can make it. So, it's another thing to be grateful of the level of care that we do have now as opposed to, back in the 60s. So, um, but I also like this picture in the bottom right, because there's my great Uncle John, and that young child is my Uncle Wayne, who also had Hunter syndrome. And this is a picture of my Uncle Wayne. And on the bottom left, there's the continuation of my Uncle Wayne hanging out with little me. Um, so yep, so he's still alive, 69 years old. We both just had our September birthdays and celebrated in Disney this year, so that was a lot of fun. And he made a career out of becoming a pastor, and he got married and had two beautiful daughters, and has a family, and he's got two grandchildren now. So um, even though he's feeling tired, he's lived a long life, and he's doing very well, and everything. So it's pretty neat, just even my family, just to see how every generation has lived longer and healthier and had I shouldn't say fuller life, but a longer life, we'll say. Um, so for me, I'm a little bit more of a wild child, and I have a two bachelor's degree in fine arts and marketing, and I've been very always drawn towards creativity and wackiness. So here are a few examples of some of my illustrations and comics and design work that I've done in the past for various businesses and publications and all that. Um, and I've been really driven towards doing performances, acting, being on stage, playing music. There's a picture of me jumping way up high in a orange shirt. I can't do that now, but boy, I was, had a good time. So, and I was in a pirate band, singing sea shanties and performing and all that. So, you know, the, that was a lot of fun. And a lot of this I did when I was still, even before I started ERT, and I have an attenuated thing. So at the time, I was able to kind of ignore it. And so I just kind of lived life as full as I can, because always in the back of my head, I always kind of knew that it would eventually catch up with something I have to deal with. So when I did ERT, it was kind of a jolt to my system because it's like, oh, now there is something that I can actually do to do make it better or be healthier. This is something that's actually addressing the root cause, the root problem, as opposed to coming up with treatments for the effects of the disorder. So oh, well, here's some more things. Like I've done tons of traveling. I've been all over the place. I have a really cool, awesome back tattoo. That was actually taken in Malaysia. So that was pretty wild. Lots of friends. So I'm very grateful for that. And this is another thing that was reminding me while I was really sick in the hospital with the COVID pneumonia, and my heart later went to AFib, is just the amount of outpouring of support and um, help that all these people that I've touched in my life. So that reminds me not to get too drowned out in the physical and the pain of the moment, and just be grateful for the people we have touched and had a positive effect. Um, so yeah, so you can see this is a timeline of me pictures from a little kid moving up, and you can see slowly how Hunter syndrome, still, you changed, and affected my body. And, this is even after I did get ERT. I do think it slowed things down, but it still has an effect. But I guess I was generally a pretty happy kid, so I guess that's a good thing. Um, when I was young, I would get sick a lot, and once again, I'm grateful because my mother, she was the sister of Hunter's patient, and her mother was a niece, sister, mother, grandmother. So when I showed the signs of that, um, mom, was able to do it. And we were never, my Uncle Wayne was diagnosed when he was a kid at the Shriners Hospital in Erie, but they did kind of like, we think it's Hunter's. So there was that assumption. And when then I started showing the signs, my mother went out and actually got a genetic test from John Hopkins where that was the definite. It's like, okay, we definitely know now this is Hunter syndrome. And that was when we first were connected with the National MPS Society um, and all that. So throughout that time, mom was always driven. I'm one of Dr. Munzer's early patients when he was at NIH. So working on an experimental potential treatment at the time. So throughout my time between me and my family and my mother, we've always been driven to do what we can to further medical science and not only, try to improve our lot in life or quality of life, but also use those experiences so that other families can, um, benefit from whatever is learned through these things. So, um, yeah, like I said, I tried to live as normal as I could, but once ERT started, yeah, really kind of changed my whole outlook on life and everything. So, um, yeah, my late 20s, I started having more problems with hearing. Had to get hearing aids, and that could partially because I also played a lot of rock and roll. But, um, I did have sleep apnea and lung issues, umbilical hernia, knee lesions, and spinal decompression. So you can see how they fused my neck. And you can see the screws, and these were taken right after the surgery. And then a year later, I went in for a follow up, and turns out one of the screws had broken and another one was loose. So the surgeon wasn't there, but one of the his assistants was like, "Oh, you might have to go back under the knife and go back in." And I was terrified for like an hour waiting for the surgeon to give me a call, and because it was a really invasive surgery, and he called, it's like, no, it's fine. You're fused. You can leave it there. So I guess clinically, uh, I officially do have a screw loose, which is something I don't think people who know me would be that surprised at. So. Um, Anyway, this is a lot of this. I'm sure a lot of you are familiar with the pluses and minuses of this American healthcare system that we have, but these are just a few things that I have to address, and I know a lot of families do. Once again, I do feel grateful because I've been in the system. I have Social Security with disability. Um, and I'm in the system, and once you're in it, you're kind of in it. Then it was really difficult, and I know it's just a lot more difficult now, for many different reasons and everything. So even though I am in a relatively good space financially, dealing with the medical issues and the doctors and connections, it is something that I still have to be concerned about. And I know a lot of people in our MPS community also have to really worry about, especially parents, or newly diagnosed who've never had it in their family. So, in your practice is just something just to be reminded of when you're talking to your patients or whatever role you play within the MPS community or anything. Um, so. But despite difficulties and losses, and like I said, I just had a really bad brushing really lately, and that really was very difficult. But I try very hard to be grateful. I'm especially grateful that I had Dr. Munzer. We have had such a long history. Mom is able to give him a call, and he's very good talking with the doctors that are treating me and everything. So I'm very grateful for all that during my time, and I'm also grateful here. Like I after my neck surgery, the hospital food was so bad. I got the food people to send me up a lot of Tabasco sauce to make the food palatable. So I was extra happy there. Never mind the pain meds, but it was a double whammy of awesomeness. So anyway, any questions? I think that's the end of my presentation. So um, let me bring up the stop share if I can. Ooh, okay. How do I do it? Stop share. There we go.
There you go.
All right, there we go.
Thanks,
So yes,
Jason. Yeah, it's always an enjoyable session with you. And we learn so much too. So,
in a
so
setting like this, I don't know if my jokes land because I can't hear
I
everybody.
know, right? They landed. Dr. Munzer chuckled, so
Right.
you're good. Um, so one of the things that struck me was that you said when you started ERT, it was like a jolt to your system. And I think for many of us that haven't had ERT, I'm sort of curious what it feels like and how soon did you feel effect or do you feel effect now?
All right. So when I say jolt to the system, I mean more that's like a mental jolt.
Yeah.
That's what I meant. It was very strange. I remember, and this is weird, like the first time I went to the bathroom after being like, wow, I'm just getting rid of this gunk. This is just
Mm,
gone out now. Just there it goes. This is so weird. Um, I didn't notice right away any physical changes, and it's hard for me to really know how I would feel without it, or where I would be. But I did all of a sudden stop getting sick as frequently. I had people tell me my facial features softened up, they were less
mhm,
coarse. I know now when I'm not on ERT for about 3 weeks, and every patient's different. Some feel it sooner, but around me, 3 weeks, I just start not feeling well. I get sluggish. Um, it's when you ask other MPS people, they kind of start like almost like rubbing their tummy. It's like I don't.
Yeah,
Um, and I think that's partially because of the effect that it has on the liver, and you
that's
know,
right. Spleen.
so it just doesn't. Things aren't working right when you don't have it. Um, once again, I haven't had anything that actually crosses the blood-brain barrier, so I'm not sure if that would actually, make a difference right away. Um, but that's my experience with that. So, um,
Yeah, can you, and quickly, because we just have about 2 minutes and Dr. Munzer will give me the hook. Uh, can you talk about that a little bit? I think, we hear a lot and people think, oh, you have an attenuated version of MPS 2, so there's no cognitive issues at that point. I think that's probably not true.
yeah,
Not that
no,
you,
and it's hard for me to know exactly at Hunter syndrome, but I do know I'm getting a little bit brain foggy and with the hearing and the eyes. And I've had talked to MPS people on MPS 1 who have had clinical trials where, that crossed blood-brain barrier, and they just say, wow, it's like fog was lifted. I was able to think so well and so straight again. So I'm personally looking forward to, the time when one of these treatments that's going on, just so I can try it, just to see if that helps clear things up. I don't know if it's just getting older, whether it's the effect of the COVID or um, my hard rock and roll days, or I'm sure it's a combination of everything. But and I do think it would help with the spinal compression, because you're finally
Mhm.
there, and that was a really difficult surgery. So I feel really bad for the people who have to go do that more than once. That's really hard. So I'm looking forward to all this stuff, and I think it'll be a game changer for those who are more severely affected and those who are attenuated, I think will be beneficial for all of us.
Yeah. Thank you, Jason. I agree with you on that. We're all ready for it, better treatments to come along.
And just in that regard, I'll give a presentation at the end of the session tomorrow talking about new therapies and what people know what's out there in the future.